Okay. Hey, here today with Neil, and of course this is Dr. Yates in Chicago, and we're always wanting to talk about, FUE, the ARTAS robot, and kind of the results we're getting, because, online you hear a lot of things. You hear, well, it's kind of good, some people say it's no good, and then of course I say, what? It's great. Okay, so here we go. I want to introduce you to a patient of mine named Neil. And Neil's had a hair transplant, about 10 months ago?
Yeah, it was done right at the end of last year, 10 months.
So 10 months. Now, why is that important? Because a lot of people always say, well, they will get calls at 4 months and even at 5 months and say, hey, Dr. Yates, my hair is not growing. What's the matter? Is it going to grow? Did you guys do it right? Did I make the right decision? But usually by 8 to 10 months, I'd say, you're going to see about 70% of the hair growth. More hair is going to come in, but at that time that you can really get an idea of what's going to go on. I mean, Neil, what would you say, when did you start noticing that, because this is your first hair transplant, right?
Yes.
When did you notice that the hair was starting to grow, and you believed me that, because the first time you have a hair transplant, it's all on what? On blind faith, because you did internet research, right?
I sure did.
Right, because Neil's a smart man. You're an engineer?
Yes, sir.
He's an engineer, so he can read and write and do calculations, So he went to the internet, and did research, came to me, and on blind faith, plus research, had a hair transplant. So when did you really in your mind believe that, hey, what Dr. Yates said is true?
I would say at the 4 to 5 month range. I would take the mirror, look at the top of my head every day, and for the first 3 or 4 months you're like, wow, I don't see much action here. And at about 5 months, then the hairs began to lengthen, the density began to increase, and I'm like, aha. So when one embarks on any type of operation like this, patience is a virtue, especially for the first half.
Right. I'd agree with that. Now the thing is, everything in what we do is making an improvement. So I want to show some pictures, and Neil hasn't seen these in 10 months, so I'm going to show them to him, then we're going to show them to you, because we want you to see what we see. Okay, I'm going to show this to you first, Neil. Tell me, is this you?
Yes, sir, it is.
Okay, sound like a lawyer. This is how the lawyers do. Does this represent you? Okay. Neil, would you say this is a fair representation of you?
Not at the present day, but it sure was at the beginning.
Okay. Is it okay if we show the rest of the world?
Go right ahead.
All right. I think this is my favorite. I'm going to call this, not to make fun, the alfalfa shot. Okay? Okay? Now, are you close to that one?
I am.
Okay, good. Okay. So come in good.
Trying to get the lights out of it.
All right.
There we go.
Good. So we see that one. Now, a lot of people will say, like if I saw that picture online, I would say, that's not him, because I can't tell anything there. That's not his head. That's not him. So I want you to see now. Let's look at this one. Okay. This is him. Okay. So that's his pre-op shot. All right. So I want you to take a good look at that so you can see that that's him. Because a lot of times when I see pictures online, even me, I'll look at things and I'll say, oh, that can't be that person, because, they don't have that mole there, or, the nose is this, or this is that. So you have to get the right person. So look at this one more time. Okay, so did you get a good shot of that? Okay, well, the best shot you can, we'll just take it. Okay, so Neil, I want to ask you now come in on Neil's hair now, so we'll get a good look. This is all fancy, hair. Now it always depends. You can see Neil in his pre-op area, he didn't have any hair up in what we call the front and the mid-scalp, okay? So when you have your first procedure, it's really hard to move hair to go through everything, because we see ads all the time where people are saying, oh, I want a full head of hair. But that's kind of unrealistic if you don't have hair in the front and the back. So you always want to concentrate on this frontal view. So what we did with Neil, now hold your head down a little bit, we did basically 3,000 grafts from about here to here. That's from the hairline back to where we consider this vanishing point. And I usually plant at about 25 to 30 sometimes a little over 30 grafts or follicular units per square centimeters. I know there's debate on how many grafts you should plant, but there's also debate on if you plant X amount of grafts, do they grow? I've just found in my hands that seems to be the sweet spot for graft growth and giving the best appearance. Now you can see with his hair 3,000 grafts from here to here. You know, if you measure this is about a little over 100 square centimeters. So if you do the math, it works out to around 25, to 30 grafts per square centimeter. So we're right in that range that I always do. For 10 months, I think the growth is excellent. Will he get more hair? Yes. He will get new growth of hair. This hair that's here will thicken. So it's, is most of it done? I would say yes. Most of it's done, but there is still more to come. So Neil, has anyone said anything, about your appearance or the change in it? And then just why did you do this anyway? I mean, because you were a nice looking fella anyway.
Thanks.
You didn't have to do this,
I've gotten comments from friends, I've gotten comments from coworkers, unsolicited comments. Hey, nice hair, Neil. Wow, what did you do? And then I would explain that I came to Dr. Yates' office.
And you had the ARTAS procedure.
Yes, I did.
Right.
Yeah. After a lot of research, I determined I wanted to have it be my hair, not
fake hair.
Not fake hair.
No matter what they call that, the ultra strand or stranding ultra or whatever the fancy words are.
No,
We're smarter than that.
I wanted it to be me. And my main reason for doing it was admittedly to fight age a little bit. I know, as males get older, the testosterone level drops, the hair thins out, and I says, well, I'd like to regain a little bit of youth. To me, I felt that in going forward in my professional career, that appearances do matter to some extent, and I would rather give off an aura of being more on the youthful side versus looking older than what my age would have me to be.
Yeah, I'd agree. They call that a disconnect, where your age, even though your actual age, your physical body, you look a lot younger. And just with the addition of hair, that will take you back 10, 15 years. It's kind of like in music, what we call a grace note, where it's the added hair is just like a little ornamental change that makes a big difference in the end. I always think to myself, people have so much hair back here that's not doing you any good. Like if these pictures here, he has his donor is you can't see his donor, but he has great donor. Okay, so why would you not want to take good donor and expertly place it up here? I don't understand why people wouldn't want to do that. So a lot of people that I see that say, oh, I'm okay with this and that and so forth and so on, that's okay if you're really okay with it. But if you're not okay with it, you just have to make a decision to come in and discuss what can be done. Of course, we do the ARTAS, we do FUE, because we're very scar adverse to that long scar in the back. Because why would you want to, every time you go to your barber, have to give them instructions to cut your hair? You go to your stylist, you just say, cut my hair. You don't have to say, hey, I have this scar back here, use a number 3, take it to a number 4, and then, curve around to a number 6. You just want to say, hey, cut my hair, flip it, whip it, or whatever you want to do. So that's what we're trying to do. We're very sensitive to patients' needs. We're about changing people's lives. And I think, Neil, if you had to say to people, like what is Siskel and Ebert would say, thumbs up or thumbs down for a hair transplant, what would you say?
Thumbs up.
Thumbs up in Chicago. It's Dr. Yates. Thank you.